Thank you, Dr. Turner. Thank you for your leadership, and thank you for the opportunity to participate today. Good morning. I'm Ronald Stewart. Sadly, I'm here today as a trauma surgeon who has cared for the two of the largest mass shootings in modern U.S. history, the Southern Springs First Baptist Church and the Uvalde school shootings. These injuries inflicted by high-velocity weapons used at both of these attacks are horrific. A high-capacity magazine-fed semi-automatic rifle such as the AR-15 causes extremely destructive tissue wounds. These wounds are horribly lethal at close range. And sadly, most victims do not survive long enough to make it to a trauma center. Our team at University Health received 4 patients from the Uvalde shooting, and all of our current patients are improving, which really brings us joy in this dark time. But all of them have a long road to deal with recovery, with both the physical and emotional impact of their injuries. And unfortunately, this moment of crisis will have a lifetime of impact on these innocent souls. And our teams are working together to facilitate healing in a way that minimizes long-term impact and effect. I'm very proud and honored to work with the American College of Surgeons, and the ACS has worked tirelessly to establish regional organized trauma systems of care that make a real-life difference in our patients, in our communities all across the U.S. In many ways, South Texas has a model trauma system. It's modeled on the ACS system, and this system worked extremely well in both Southern Springs and Uvalde to coordinate and communicate the situation from the scene and improve the care of those patients. Using our trauma system in Uvalde, we were able to get whole blood directly to the scene, which appears to have made a real difference in at least one of our patients. As an action item from Southern Springs mass shooting, we increased Stop the Bleed education and training, and advocated for state Stop the Bleed education training, and partnered with Representative Barbara Gervin Hawkins on Texas House Bill 496, which implemented that training and equipment in Texas schools. So having a great trauma care system, implementing the ACS Stop the Bleed education program, and regional whole blood are all critically important programs that do make a real difference in our patients' lives. But they're not enough. They're not enough. Those are all mainly treatment things, and treatment is not enough. We have to effectively prevent these tragedies, and they are preventable. They are preventable. They're preventable by using the principles articulated by Dr. Turner. A key facet of the ACS trauma system approach is working together to serve the best interest of our patients and our communities. Working together to serve the best interest of our patients and communities. A trauma system encourages and enhances, hardwires cooperation and communication, because cooperation and communication save lives. But it hardwires that cooperation, communication, and partnerships even among competitors. Even among competitors, that is necessary. And the ACS approach centers around a common narrative with respect to firearm injury prevention that really facilitates working together. It facilitates working together. An inclusive narrative that goes something like this. Firearm ownership is a constitutionally protected liberty. It is. And we also, though, have, as Dr. Turner pointed out, an epidemic of violence and firearm-related injury, death, and disability in the United States. 2020 was the year that firearm-related injury became the #1 cause of death of U.S. children and adolescents. I'm not talking the #1 trauma-related cause. The #1 cause of death of U.S. children and adolescents is firearm-related injury in 2020. And the deaths are just the tip of the iceberg. The deaths are just the tip of the iceberg. So what can we do? Well, using the common narrative, we can address this epidemic of violence by continuing to work together to do two things. One, work to understand and address the root causes of violence. Work to understand and address the root causes of violence while simultaneously working together to make firearm ownership as safe as reasonably possible for those who own a firearm and for those who do not. We can prevent these atrocities by working together. And I'm going to say, and this team all knows it, that the American College of Surgeons Committee on Trauma has proven that people who hold very different views on firearms can and will harmoniously work together, hand in hand, to develop programs and strategies that reduce unnecessary death and suffering of our patients, our families, and our communities. It is possible to do. We have proven that it is possible to do that. So our FAST and iSave work group recommendations provides a pathway to do just that. And it is our fervent hope that legislation that incorporates our FAST and iSave groups can pass at the federal and state levels. We can save lives. We know we can do it, and we must act. If we increase cooperation and communication, work together, talk together, I know we can find a way forward. The public wants and expects us to do that. The medical community has the expertise in caring for the patients, and we know that if we bring a health and medical approach to this, to the legislative table, we can really make a difference. Thank you very much.